Okay, this is Ruth Goulston, and she was a nurse, and she's going to tell us a little bit about herself.
Hi, my name's Ruth, and I grew up in Massachusetts, and I always wanted to be a nurse from when I was a little girl. And so, when I graduated high school, I went to work. While I was in high school, I went to work as a nurse's aide in a small hospital. Then I went to nursing school, and I became an RN, and that was in the days when an RN could become a nurse in 3 years. It was a nursing program. And you feel the biggest challenge in my career were, first of all, graduating from school. That was a big obstacle because I came from a family that didn't have a lot of money, and it was very important for me to finish. And I went to work in a local hospital, and I worked all over the place. I worked in the emergency room, I worked in a med-surg floor, I worked in the operating room. After almost 2 years, I left the hospital that I was working at and went with a friend to California because we were going to have an adventure and see the world. And while we were there, we worked at the LA County General Hospital, which was a very large hospital that had, at that time, infectious diseases. And it was really a very, very stressful time. But we didn't stay there long. We were very homesick. So
what kind of diseases did they have at that time? What year was that about?
This was 1957 and 58. And we worked there for a year. We came back to Massachusetts because we were homesick. And then I went to work in a small hospital, and I worked in the operating room, and I loved the operating room work. But that hospital was very small, and it was scheduled to close. So after that time, I went to work in another hospital, and I worked at night, and because I was married and had little children, and it was very convenient to work at night. So there's a lot of advantages to nursing. You can work all kinds of shifts. You can work in the daytime, you can work evenings, you can work nights. You can accommodate it to your life schedule. And I was married and had little children, and so I needed to work nights because I needed to keep working. So I worked 3 nights a week. I had a good husband, so I didn't have to work full time. And I did that until probably for 10, 12 years. And when I got a chance, I went on the day shift. And on the day shift, I worked 4 days a week. I was still working nights for probably 10 years. And then I finally got the chance to go on the day shift, and I went on the day shift. And they were short in maternity, so I said, all right, I'll try it. I'll stay in maternity. And I found out that I loved the maternity ward. I loved working in the delivery room. I loved the challenge of helping people through labor and delivery, and the doctors, and it was a very different kind of a relationship than doing med-surg on a nursing floor.
How was it different? Like when you say the relationships were different, between the nurses and the doctors, or between the nurses and the patients?
Everything. Because you had a one-on-one relationship with your patients because you were taking them through a journey. They were having a baby. And the doctors, in those days, we didn't have fetal monitors, and we had to learn when it was appropriate to call the doctor, and and give them enough time to get there, because they didn't have to stay there at that time. And at one point, I was working at night, and this is a funny story. And we called the doctor, and we waited and waited and waited, and he didn't show up. And we found out that he fell asleep, and he took the elevator and fell asleep in a laundry basket in the hospital, and ended up laying down in the basement and in the laundry basket, because he had been up for days and days working.
Wow.
That's just a funny story. But we had a lot of very serious things. We had things that we had to worry about. That was in the days before abortions were legal, and we used to get patients that came on the full unit because they were hemorrhaging, or they had infections, because they had misguided people trying to have them abort, and it was very scary times. So these patients were very ill because they didn't know the correct things to do, and abortions were not legal. So
did any of the babies get born like crippled or anything?
No,
because of
they
that?
would have miscarriages, but sometimes they would have hemorrhages and everything. But that was why, when abortions became legal and they could do abortions, it became very important to support that program.
That cause.
Because the freedom to have a baby or not should be a woman's choice. And it's always been a very important choice. Most people don't get pregnant on purpose. Today's, you have many choices. You can go on the pill. You can have internal gadgets that help you not to get pregnant. So I don't believe in restricting the abortions. I do believe that you shouldn't abort a baby after I don't know how many weeks. 16 to 20 week a baby is viable. So you should not abort a baby after 16 weeks. What else do you want to know?
So, so it sounds like you would definitely choose that career again, and
Oh,
it was
yeah.
very accommodating to you. So that was you feel like that is the most important thing, that you were able to have the lifestyle that you wanted, and the flexibility in your schedule was huge to
That's
you,
right.
to accommodate you. And so that's the advice that you would give to the younger
a
generation.
teenager who doesn't know where they want to go. Today they have to be a nurse. You have to go to college. So the nurses have a Bachelor of Science degree, and there are a lot of different fields. You can work in an office. You can work in a hospital. You can work in an operating room. There are a lot.
Did you ever have a terrible experience that you want to share, or that you, or a day that you just wanted to quit your job, like an incident that took place that maybe somebody could benefit from hearing?
Not really. I'm sure that I had experiences that I didn't want to have, but I at this time I don't want to share.
Okay. And what about how hospitals are managed, like today, versus how they were managed maybe when you began? Like, did you see a change in management?
Oh, there's a whole big change in how the nurses work, the management. The nurses now have unions. Almost every hospital has a nursing union, and they designate how many nurses have to be on a unit, how many patients you can have.
Do you feel that was a positive?
That was a very positive move, because in the old days, I mean, there were 20 patients in the hospital and there were 3 nurses, you had to share those 20 patients. And now there are rules that if you get too many patients, you have to send them to another hospital.
And what do you think are the most important skills that you need to have in order to be a nurse and be a successful nurse? Like, I'm sure you saw nurses that you shook your head and said they should not be nurses. What were those qualities? What made you such a good nurse? Why do you feel like, I know you're passionate about it, but what do you feel that the patient or the doctors benefited, like, when the other nurses?
Well, first of all, I feel that I was very caring. In fact, I got flowers and chocolates from some of my patients, and I think that's a positive thing. And also, it's important to have empathy for your patients, because patients, they're going through trauma. One very sad experience that I'll never forget was a 15-year-old girl that came in and had a baby. Her mother was her support person, and she cried all through the labor and delivery because she felt embarrassed that her mother saw her having a baby and she wasn't married and she wasn't going to have any way to support this child. She cried and cried and cried because she felt embarrassed that she was pregnant. And
did you ever find out what happened to her?
Today, I don't think you see that as much, because I think families are more open and they talk to each other, and the girls tell their mothers. And
were there services then that
they
would
have
help?
a chance to talk about it, to explore it, that they can give the baby up, that you don't have to have an abortion. You can give the baby up for adoption. You can do a lot of different things. There's closed adoption, open adoption. You know, in the old days, a relative sometimes would take a baby and say that it was theirs. But today you don't see that so much. You have the department and the delivery is a very different area.
Well, thank you so much for your wonderful service and for your contribution. I'm sure that these future students will really appreciate it. Thank you, Ruth.
All right.